What advice do you have on
Yeah.
like a nurse who has no idea where to start?
That's a great question. I feel like if you have no idea where to start, think about what interests you in the nursing world. Like some people will know, like, I never want to work with adults. So that's great. That knocks off a big chunk of, of nursing jobs. And now you can focus on the peds world or you want to work with babies. So figure out like, okay, do I want to maybe work with adults? What do I work with peds? And then look at your lifestyle too. Like, do I want to travel? Do I want to be in the hospital setting? Do you want to be more outpatient? What type of hours do you need? Do you need more the like 8 to 5, or do you want to like work your 3 shifts and have 4 days off a week? So there's a multitude of things that you can kind of look at. And then once you kind of find out, okay, yeah, I want to work 3 shifts a week. I like the hospital setting and peds is not my thing. Well, now go look at the adult positions. And it sounds so simple and it's not. And sometimes it's just that trial and error of like, okay, I'm going to go do med surge. Great. I didn't like it at all. So what did I like from it? Maybe I should do something similar to that. Maybe you like really taking care of the cardiac patients. So you want to do CVICU and you can kind of narrow it down. And sometimes like kind of like it sounds like for you, you just needed that exposure
Mhm.
to kind of build up your foundation and knowledge to figure out what you wanted to do. Or you kind of, I don't know, you sounds like you kind of just almost stumbled upon like getting that like really specialized
Totally.
fertility nurse position and it's just worked out great. But if you never had that exposure to it, maybe you wouldn't have picked it for yourself. I don't
Yeah.
know.
So true.